Hello, good morning to all of you here in the room. Welcome to everyone who is joining us for this session on the longevity dividend, rethinking capability in the aging world. Global populations are living longer. We all know this. This demographic shift is reshaping labor markets, healthcare demand, of design and policy innovation together can unlock the longevity dividend for the society. My name is Magdalena Skipper. I am editor-in-chief of Nature, a journal of science across the globe. And with me, I have a wonderful panel starting from my right here, Elizabeth Staudinger, who is member of the board of Siemens Healthineers. Next to her is Hala Nazari, lead of longevity economy at the World Economic Forum. And over at my far right is Heidi Gardner, distinguished fellow at Harvard Law School. Welcome to this conversation. So let's start by focusing on the capability first. Elizabeth, I want to turn to you first. So we talk about lifespan, but the dividend depends on health span, very obviously. What interventions offer the biggest population level return from your perspective?
This concept of health span is incredibly important in that context. And if you look at how can we somehow remain healthy, remain able to participate in society, remain able to also participate potentially in the workforce, it is about trying to catch disease as early as possible. Our healthcare system is very much geared towards kind of stepping in when you are in trouble, right? And typically there is a very long time period where things are building up until you actually hit that wall where you say, now I really need to go and see a doctor. And if we find a way, right, of changing that logic in the healthcare system and start screening and detecting disease earlier, there's a huge opportunity for us to expand that lifespan. And there's really something to gain from doing this, because if you look at the data, every healthy year, somebody can continue to be part of the workforce and contribute in an active way to society, kind of comes at a dividend of twice the GDP per capita. So there's a real incentive for people to stay healthy. And this early intervention, sometimes it's 5, 10 years before something really becomes a problem. If you pick up on it by diagnostic means, you have a huge range of possibilities how you can intervene, so you can avoid that you ever get to the point where you really need the serious treatment. And it's much cheaper. Yeah? So you get more capability of people to contribute to the economy, contribute to society, and you can save cost for the healthcare system.
Absolutely. And it's such a, we all know that prevention is better than the cure. It's an adage that is so often repeated. And yet you're absolutely right that the modern medicine is much more geared towards treatment and cure rather than prevention, although of course that's changing. So coming back to that question about the population scale, if I'm going to push you a little bit further on that, how do you think, what is needed to shift that focus towards screening for the early detection that you talked about that is really crucial to make a change?
There is, and this is most likely really a big debate, is how to shift from this way how we ensure health, yeah, to or where we insure against illness, so to say, to look for ways of ensuring health, and to find ways of incentivizing that early detection and that early screening. At the moment, it's not very attractive, right? It's a cheap thing to do. It usually doesn't result in any work a physician can charge or bill, so it just doesn't happen. And I do believe we need a very fundamental debate. What does it take kind of to change these behaviors and to really support a concept where you try to intervene long before you have a really big issue.
That's right. So it's a behavioral change and really a long-term investment, right? In so many ways. So we'll come back to this point, I'm sure. Helen, I want to turn to you with the following question. So, as we live longer lives, there is a danger that those later years are spent living at the margins of society. How can we prevent that? What do you see as the most important thing to focus on?
Sure. First, I'd like to say how happy I am that we're talking about a longevity dividend, and we haven't framed this discussion around this idea of a silver tsunami. I think it is the right way of thinking about people living longer lives as a dividend, as an opportunity, as a positive thing. So I think that's great first, and I just want to thank the sponsors for that. Second, so I think what we really have to do when it comes to health span, when it comes to longer lives, when it comes to pensions, when it comes to everything related to longevity is rethinking and reframing and reimagining what we need to do. We've never been in this situation before where we have more older people than younger people, and we can't expect our current systems to work the way they always have. So I think for health systems, we need to completely reimagine what that looks like to live a longer life, like you've said. And to prevent people from living on the margins, I think we have to start thinking of getting older as a positive thing, not as an end, but as a transition, as a kind of a point to a next point. So I think if we think of aging and getting older as a positive thing, something to look forward to, I think we think about it a little less of being on the margins. We don't think, oh, well, you're older, you can go home, or you can go play golf, or you can go do this. It is an opportunity to keep growing as we go. And the other thing is, I think we think about older people the way we have in the past, but it's been proven that today's 60-year-old is not the same physiologically, mentally, in any way as a 60-year-old from 30 years ago. So we've evolved, we're healthier, things are different, and so our thinking should evolve with that point too.
Very good point, and I'm so glad that you mentioned just now specifically how a 60-year-old today is not directly comparable with a 60-year-old in a previous generation. We had a little bit of this conversation before we came on stage, and it's not just physical health; it's mental health as well. It's that mental focus and readiness to engage. So that's from a perspective of an individual, of individuals who of course make up groups. Can I push you a little bit further and ask you, how do you see, are the societies ready to embrace every stage of life? Because of course, being older is a stage of life. And I would probably guess that we're not quite ready yet. I would say we're not quite ready yet. What do you see as the biggest opportunity to change that, to make society more ready? Individuals in those later days are ready, very clearly.
Right. I think you're right. I think we're not quite there yet, but I don't think it takes a lot to get us there. I think it's thinking about intentional design, intentionally creating more intergenerational societies where we include older people with younger people and in between. So no, we're not there yet, but we can get there. And I think what it requires is having these kind of conversations. Because the other thing I've noticed in doing this work is we think it'll magically happen, that suddenly we're an age-inclusive society. But we actually have to have these difficult conversations and start talking about, well, what does that look like? How do we need to rethink workforces? How do we need to make it more age-inclusive? What do we need to rethink about cities and our communities to make it good for all generations? You know, when we create a playground, maybe we can think about another kind of area for older people. So both generations are together and we think about it holistically, all of the citizens of our communities.
It's a great example, and I'm glad you mentioned cities as well, because I would probably argue that urban environments are less well integrated across the ages than maybe smaller communities. But you mentioned the workplace, and I want to bring you into this conversation now, Heidi. So, of course, as lifespan extends, so does the working life, which means that this has consequences for organizations, workplaces become more age diverse. So how do we need to rethink current leadership, current organization models to embrace that diversity of ages and be more inclusive of
Yeah, I think
that
it's
workforce?
such an important question. I should say my answer is informed by about 2 decades of research on what I call smarter collaboration. And so initially, I was thinking about how do you get people to come together across silos, be that the doctors in the administration in a healthcare system or across departments in an organization. And we realized as this conversation started to take on more and more urgency that we could bring some of those same solutions to thinking about cross-generational collaboration. And it matters so much because that's how you unlock potential. Because as long as we have older, more experienced, I'd say wiser people in the workforce, unless we do integrate them through a whole range of measures, they're just going to be potential value and not true value. So one of the things that I think organizations need to think very carefully about is much more agile positions. Right? Rather than a career track where one essentially climbs a ladder, reaches the top, leaves their job, and that's it, right? Let's think about off ramps. Let's think about longer ramps where people have an ability to contribute in a very meaningful way, not necessarily full-time, super high pressure, top of the hierarchy. And I think that by embracing this idea that people have much to contribute in quite different ways should allow us to be much more flexible, personalized, forward-thinking in how we create this cross-generational collaboration, because that's what's really going to help us turn it into this dividend we've been talking about.
It's such an important point to be less rigid in terms of, as you say, career progression, but structures within organizations. There's one thing I want to follow up on in this context that you were just sharing with us that I rather suspect is on the minds of everyone here. As technology develops at a really rapid pace, ever increasingly so, there is a sense amongst the more mature generations, but also amongst the colleagues, that perhaps somehow they find it more difficult to integrate. How do we tackle that fear, which of course often is misplaced? How do we overcome that potential problem in organizations?
So one of the structures that we've recommended to organizations that some of them have quite productively adopted is reverse mentoring, right? So typically we think about mentoring as, well, I'm seeing some knowing looks around here, right? That's great. So typically we think of mentoring as senior to junior, imparting a one-way knowledge flow. And when we've recommended the reverse, technology is a perfect way, a perfect subject where people can acknowledge that there are opportunities for knowledge flow in all directions, really, and helping people create that safe space where all generations can ask each other, questions, where they can seek help, when they can be a bit vulnerable and admit that they don't know everything. I think that helps to create the kind of culture of a greater inclusivity where people can genuinely contribute in their unique ways. And we don't expect everybody to be brilliant at everything.
I think that's such an important point. And by the way, I discovered reverse mentoring probably about 7 years ago or something like that. I love it. I learn so much from my younger, more junior colleagues and actually younger members of society.
And maybe as it becomes more common, we'll drop the word reverse,
right,
because we no longer
mentoring.
have to distinguish it from normal mentoring.
That's
right.
right. That's right. It's really, really important. Let's move on to more specific ideas of what must change to enable some of the things that each one of you talked about from your individual perspectives, but of course they all must come together in order for us to be successful. So Elizabeth, maybe focusing on what Siemens Healthineers provide to support this, what do you see as the most important scalable intervention that could add healthy working years at a population level?
For me, this is clearly early diagnosis. And there is a lot of foundation which is available for us to use this. Yeah, there is infrastructure to do blood testing. There's infrastructure to do maybe scanning or screening type of interventions. And I believe there is a lot to be gained if we look for ways of scaling up this screening and touching wider parts of the population who don't feel sick yet. To create this idea that maybe I just go and check, right, and get some feedback and then use this information I get from there to then kind of either I get my check mark and said everything fine, or I get a feedback said, oh, maybe you should attend to this or that dimension. And if sometimes when you speak about this, oh, we need to do more screening, there is a lot of worry about cost, kind of who will be able to pay for this. And I think this is something where we maybe overestimate what it takes. First of all, there is a lot of infrastructure available, especially in the more mature systems. There is in the less mature healthcare systems, there is a need to build that foundational structure anyways, because you also need it for the more severe interventions. And if you look at the total cost of what it takes to create that infrastructure, it's only 2% of everything that is being spent. So once you start digging and really double clicking on it, it's actually not the money which is the biggest barrier. There is a lot about adoption, and there is a lot about making it easy for people to engage, right? It should be seamless, it should be low barrier to get this type of access to screening. And I do believe with the new technologies becoming online now, with especially AI and the possibilities of AI to interpret screening results, we can further really reduce down the cost and make it even more easy, accessible, and something which truly can scale to an entire population, and not only to those like today where very educated people kind of understand and they look after themselves and they pay for all of those. I believe it's not that expensive to scale it to everybody.
And so thinking at a population level to bring about that transition of thinking that we need to look at prevention, and the foundation of that is screening, who do you think will be who should drive this behavioral change for us to be most successful as societies? Is it the individuals? Is it the health practitioners? Is it the workplace? Is it some other context? What do you think might be most effective?
I think you will need everybody, right? Without an individual interested in going down or following that journey, you can put policies in place as much as you want, and it will not help. You need the policy framework, but also really like this idea of maybe the workplace can play a bigger role when it comes to facilitating, encouraging, kind of creating these events, moments, whatever, where it just becomes, well, instead of kind of your first hour in the office today, you just go and get your check, and you make it part of something which is just interwoven in your normal workday. It could actually be an interesting approach.
Could I build on that? I'm thinking, if workplaces, if corporates, et cetera, get better at reaping the benefits of a wiser, older, more experienced workforce, they'd be more willing to invest in this, right? It changes from a cost to an investment if they feel like they can unlock the potential and the productivity from that. I've had the privilege of living and working on 4 different continents, and I think the answer surely is it depends. When you think about who might bear responsibility, at least for normalizing this kind of practice, because depending on the healthcare system and the insurance system, it will bear differential costs and benefits throughout that. And I think we need to be working at so many levels to make this happen.
And maybe to bring a reflection from a different conversation that I had on a different panel yesterday, we have to remember about the power of individuals' stories telling their own stories. So if we have individuals who have embraced that preventative screening and are engaging with this and maybe prevented development of some illness or something, some kind of a discomfort in later stage of life, if they tell their own story, they really engage, they will engage others and encourage them. So indeed, as you say, everyone really needs to come together. Hala, I want to follow up on on something you mentioned in response to my previous question. You talked about cities and redesigning the cities. There are a number of settings, workplaces, cities, services that today, let's face it, are not optimally designed for that inclusion that we're talking about. If you were to identify one, I'm going to give you a magic wand and you're going to redesign something, just one thing that would bring about a change at scale, what would that be?
So we've had these conversations quite a bit on the work that we do at the World Economic Forum on the longevity economy. And what we've found is just as important as big innovations are simple innovations. And the simple innovations that we've discovered that people really want in cities are things like more public restrooms, benches throughout so they can stop and rest. So I know that seems a little silly, but that's really all older people are looking for. My mom is 82. She walks 8,000 steps a day, and what allows her to do it is having benches throughout her neighborhood that she can stop and rest, and then she gets up and keeps moving. And the other thing we've heard is many older people are nervous about not being able to find a bathroom in time. So if there's a lot of public restrooms, that encourages them to move, to go outside, to exercise, to make it easier. I'm fortunate enough to live in New York City. And I think cities actually are great for older people because there's much better modes of transportation. There's a lot of different ways of getting around if you don't have a car anymore. So I think good transportation, easy, accessible transportation is another huge thing to help people leave their homes and to get around and to feel part of the community.
Absolutely, so important. By the way, I live in London, and at the moment there is a very lively conversation about a potential to remove free public transport travel for the elderly. You can imagine exactly what kind of responses that elicits. Heidi, you talked about the importance of employers, organizations investing in that longevity in the workplace. What would be the one thing that could switch towards persistent investment, that realization that this is something that's worth investing in?
I think pilots matter, right? So I always encourage organizations to run pilots. By framing a change as a pilot, it allows people to backtrack. It allows them to collect data, to evaluate and create a proof of concept. So I would, encourage organizations to create a series of experiments or pilots and see what works in terms of keeping people very productively contributing inside the workplace. I mean, and this spans from the front line in, say, retail or manufacturing, the whole way up to the C-suite. I mean, I played golf with a few former CEOs, and they couldn't believe that on the third day after they retired, their phones stopped ringing. Right? I mean, they are a treasure trove of insight and knowledge, and yet we're not tapping into them. And the same thing happens, on the front lines. And so, how do we rethink keeping that knowledge and wisdom going inside an organization?
Yeah, go ahead.
I completely agree with Heidi. And one of the things we found with some of the partners that we work with, such as Mercer and Zurich, is this idea of a phased retirement program.
Yeah, I love it.
And people are putting into motion, but it's slow going. And what that means is you don't work for 40 years and then at a certain age just drop off and stop working. You phase out that retirement. So you're still working part-time, you're still getting the social benefits of being with a community and the financial benefits, but the organization is getting that institutional knowledge. That's not leaving yet. And you still can do the mentoring, the reverse mentoring and everything. And I think, Heidi said it before, but I think what we need when we think about workforces is a more flexible workforce going forward. I think that's the way we do it. And we keep talking about productivity, and I think you can't be truly productive without all of your employees there. If I can add one more thing, one more practical thing that I think workforces can do is upskilling and reskilling. I think that needs to happen for every employee, not just young ones or the new ones. And the workplace can do that, but governments can also do that. We know about a program in Singapore that offers money to upskill when you are in your 20s. So you can take this chunk of money and go do several different programs. Then they offer that money again at 45 if you want to pivot and try something else. And I think that's critical, that you want people to think of lifelong learning as part of their journey, that school doesn't stop at college and we're continuously learning and moving. So that helps us emotionally and socially, but it also helps us in our workplaces too.
It's a great point. We haven't mentioned governments so far in our conversation, but of course, if we're going to change anything in the society, we need their support, policy and decision makers. Is there a question or a comment from the audience? We have time perhaps for one comment or a question. No? Okay, in which case I will continue. Oh, there is a question there. Mm-hmm. Perfect.
Something I'm super curious about is this prevalent stereotype that as you grow older, you grow more stuck in your ways, if that kind of makes sense, and that there can be a bit of tension between the older and younger generations to try something new. How do we think about that if we want older people with more experience to stay in the workforce longer? Sometimes I can imagine a pushback from the younger people. They were like, I couldn't wait until you retired to do something like things a different way. Yeah, how are you guys thinking about that?
Thank you. Let me repeat the question for the audience online. So the question is about the potential for less flexibility in a sort of attitude to change, maybe risk-taking as we grow older, and how that plays out in the workplace. Would anyone like go ahead, please?
I'll say one term: role modeling. Right? I think it has to start from the very top. I think when you have very senior people demonstrating, not saying, but demonstrating their curiosity, demonstrating some flexibility and encouraging that curiosity around them, I think that makes an enormous difference. You know, in virtually every society, we're somewhat status oriented and hierarchical to some degree. And so when we see people whom we respect engaging in those kinds of behaviors, I think that it sends a very strong signal. And I think it's nonsense. You can teach an old dog new tricks, but we have to make sure that people believe that and act in that way throughout the organization.
Yeah, and I agree. I think it's a stereotype. I don't believe that. I don't buy that. And I don't see that in the people around me either. I think older people are happy to learn new things. And it's something that we have to let go of as we kind of keep going on. I would have a hard time believing that somebody who's older would refuse to learn something new. My mother, I'm going to talk about again, 82, she's on TikTok more than I am. She loves it. And I never would have thought that. So I think we have to let go of these assumptions that we have about older people and reach out and see if that's true or not. You know, and I think everyone would be surprised to find out that there's more in common between younger and older people than they think. And I think both want that relationship more than we realize.
It was a great question, though, because I think it is on the mind.
Engage in sports, you will be able to kind of venture out, discover new things. And this will be supported by you being able to contribute to society, maybe by working, but also maybe by doing other things which can make a difference.
Great. Hello?
So I sit on the Center for Financial and Monetary Systems at the Forum, so I would be remiss if I didn't say financially resilient. Pensions are resilient at the age of 70, that you're able to live the kind of life that you want. I think that is a critical thing. I think also 70 doesn't look much more different than 50, to be honest. If we've done things right and we've done our preventative health and we have gotten the checkups, I'm hoping that you're healthier at that point and your health span is getting better and better.
Terrific. Heidi?
I was going to say 70 will be the new 45, maybe over optimistic, but I'll use the word connected. You know, one thing we haven't talked about is loneliness, which is a complete epidemic amongst many people, but older people, and we know that that has its own health ramifications, both physical and mental. And I hope in the coming years we will find ways to get people deeply connected with their communities, their workplaces, their places of faith, you name it, so that loneliness epidemic just dries up.
Very good point. So I think we've had a terrific conversation about longevity, emphasizing the great potential and the importance of integration, how many great opportunities lie in supporting the older parts of society together with other parts of society in the context of that society, the design, how we work, and in the workplace, all the while placing emphasis on the wellness right throughout the lifespan. Thank you very much to my panel, and thank you to all of you for being here. Thank you.
Thank you.
Thank you.